Hi, good morning, everybody. This is Andrew Lowsutea, President. Hey, thank you very much again attending our webinar. Today, we are really coming with a very important webinar because a lot of people, as you know, we all start getting age. And a lot of people don't realize if you get older, you have a chance that if you are not taking a high cholesterol, you have a chance of peripheral arterial disease. And this is something that you have to kind of understand what it is. And it has actually some sign and symptoms showing you, especially lower extremity, you can see that. Now, last week we talked about high cholesterol. What is the effect of those high cholesterol? Can be blocked your heart and also, disease and everything. That can be dangerous. So that's why we thought that we just continue this series so you have better understand besides just the heart. How about, all other areas such as peripheral, meaning all your extremities, whereby, this cholesterol can be blocking some of the vessels, and then you have issues. Why always a clamp? Why all the veins start showing up? So that's why we established lecture to get you a better understand what it is. And especially a diabetic patient, you are more prone to get that because they are high cholesterol going up, right? So that's the reason why. And I think today the lecture can be really give you some alertness, and you can able to help you to better understand and start getting the prevention. So let's start our webinar together, and then we go from there. And Edwina, thank you very much. Can you give me a 1 if you can hear me loud and clear? That would be wonderful. What is PAD? It's called Peripheral Arterial Disease. And what's that mean later? We're going to talk a lot about that. And why high cholesterol will able to get you that, especially the leg and the foot. And this is really talk about people really, especially when you get older, you're pre-diabetic, diabetic. This is something that might happen to you. So you really need to really look into it to make sure understand what it is, and so you can make some prevention out of it, okay? So today's subject is we're going to talk about what is PAD. Overview is what is peripheral arterial disease. Now, the reason why I purposely did this slide with a picture of a lady, because a lot of these ladies will see this when they have PAD. And so with that, if you start seeing this kind of vessels start popping up and stuff like that, then you really have to start, wow, hey, man, I really have some issue here. I better start taking care of either look at a doctor, see is that with high cholesterol, or I need to start doing more walking and exercise. Hopefully this will become better. So we talk a lot about that and what is a sign and symptom, and basically how to manage this and prevention this disease get worse, okay? So, and also certainly we'll teach you about how Lowsutea can help you. So today, that's what we're going to cover. And I think it's a really exciting topic because a lot of people just forget about PAD. I talk a lot of my friends who have high cholesterol, and I said, have you looked at this? And many of them say, what is that? So I thought today would be a good lecture to kind of cover and let you guys all know something that you might kind of miss. Now, I saw a lot of names in my area who come to listen to my webinar, and many of these names I don't know, so I thought that perhaps we'll catch up everybody. But very important, we try to do is give you the full stage of how you become from 3 high change to a pre-diabetic, diabetic. I think this is very important. So I just take about 2 minutes to cover that, and I think it make it very easy for you to understand. As you know, as your LDL cholesterol, which is the bad cholesterol, start going up, it starts damaging the B cell, which is the cells come up from insulin. The B cells will take sugar to the cells to use it as energy and fuel. But the B cell damage, more B cell come up, it still don't work. So you start getting insulin resistant, more sugar is circulating around the vessel. The problem is going to start because the LDL cholesterol and the sugar get together, the blood becomes very thick. When it becomes thick, you will now very quickly move to stage 2 because the thickness of this blood will start forming plaque everywhere. As you know, diabetes is really the major problem. You plaque up everywhere, your heart, your kidney, your eyes. So this is the major problem you start. Now, when the plaque starts showing, your blood pressure starts moving upward because you have less space in the vessels. Now, if you don't do anything, you have no really a sign symptom, And basically, very quickly, you will move yourself down to stage 3, which is a pre-diabetic stage. Now, the pre-diabetic stage is very simple. Just measure, all doctors do the same thing. They measure hemoglobin, which is the red cells, how many percent of sugar attached to this hemoglobin. If your hemoglobin is 5.7 and below, you're a normal person. This is called an HbA1c. So every time you're going to see the doctor, you see your pre-diabetic, diabetic, you can always say, hey, what is my A1C? Make it simple. But for a long word, it's called HbA1c. If you're 5.7, you're okay. But you're 5.7, 6.4, you are pre-diabetic. Now, you pre-diabetic, doctor will say, hey, you know, you're pre-diabetic now. Maybe you need to take care of health, change your lifestyle, and then not to eat too many sweet things. However, unfortunately, majority of people don't know. They do not really understand what that is. So majority will just continue on their own lifestyle. And if they don't do anything, 3 to 4 years, they will convert to diabetes. Now, once you convert your diabetes, your record becomes diabetes, you always stay diabetic. And that's the stage 4 stage, your A1C over 6.4, because A1C measure a 3 months average, so it's quite accurate. Now, if you are pre-diabetic, you have no medication. One thing can help you is Lowsutea, which will lower your blood sugar, cholesterol, and blood pressure. And this is why Lowsutea is so helpful for you when you are pre-diabetic. Now, why I suggest Lowsutea? Because Lowsutea has 2 things in there only. There's a guavity bits, which delay the absorption of blood sugar going to your gut vessel. And then you have the bitter melon, which is increased insulin sensitivity, taking sugar back to the cells, and also dump sugar, excess sugar, and cholesterol, and salt from urine. But when that dump, your blood pressure comes down. Because salt go down, the blood pressure will go down. And you will also get your detox also. Now, we do not just tell you, okay, just drink Lowsutea, because we have 5 programs to help you continue to lower your blood sugar, cholesterol, and also your blood pressure. But the more important, 3 programs will teach you how to change your lifestyle, to basically have better dieting, for example, how to exercise, which is 10,000 steps per day, how to lower your weight, a BMI, if you're 30, lower down to 23. You listen to our free doctor webinar every week. It's free now. You can able to understand the disease process, how you change your lifestyle, and also teach you how to measure your blood tracking, blood sugar, because you have to measure your blood before to tell that, right? So even people with as high A1C as more than 10%, we see many of my clients actually drop down to 5.7 or below 6. So they can be continually healthy. People are in 3 high, they also drop their blood sugar and cholesterol and blood pressure down, so they never go to pre-diabetic state. So that is the kind of things that we're trying to achieve here. And this is our life mission, to help you to continue to be healthy and give you a lot of knowledge so we can motivate you and empower you to be able to actually do it for yourself to become better health. And we'll hold your hand throughout this 5 program to help you to become better health. And that's what we're trying to do. And that's the objective. Well, let's talk about now, what is peripheral arterial disease? It's short, we'll call PAD, P-A-D, okay? Now, as you know, this is a condition where you have basically you have a condition that your cholesterol start blocking all the vessels. And now you are narrowing all the artery outside the heart, especially the leg. Now, that's where you're going to start seeing all the vessel, the veins start popping up on the surface, and you can see that. And typically, throughout that, your arterial is start because of narrowing, so you have lack blood supply, like food to the arm, to the leg, could be sometimes stomach or head. So all that will be affected. That is called peripheral arterial disease. Now, it is a dangerous disease, because if you really allow this continue to plugged up, it really can be able to up. You can amputate your leg and all kinds of things. We'll talk a little bit about that. Okay, what is the cause for this mechanism of PAD? Now, the problem is caused by atherosclerosis, which is meaning that you have start getting fatty substance all around fat deposit or plaque on the arterial wall. So if arterial wall is this big, right? But since that in there, there's a lot of fat and a lot of plaques that forming up, you know what? You have less blood flow going through. So when plaques start forming, your arteries become hardened, become narrow, become restricted, your blood flow goes down. Now, that is a problem because imagine if you have your leg, your blood flow, you sit down on an airplane, the blood flow doesn't work. You might even have clots that forming. You can, if you get worse as time goes on, you might actually choke off and the leg basically in some area could die, and then you have to chop off the leg. Forget it, right? So this is the reason we need to know, and you need to, understand. You need to basically have prevention. So that's why in the airplane, don't sit there for 10, 15 hours. You got to walk around every 2-3 hours, go to the bathroom, whatever. So increase your circulation. This is something that you have to watch. So what is a symptom for PAD? Most common symptom are leg pain and cramping. Now, this is always occur, especially during walking or physical activity. Whatever the time you have, you can be lying down, is always a leg pain, cramping. More often is, especially while walking, you sort of have cramp, and feel like, wow, it's really painful, And sometimes also numbness, weakness, especially on leg and feet, and that is also very common. Sometimes also the coldness of the lower leg, especially on the foot. If you look at the foot, ankle here, you feel this, it's very cold. And particularly you compare with other feet. If one feet is all plugged, you can be very cold, one feet is warm. And you can compare, touch both. Now you can also see that you're sore, that doesn't heal, especially the toe or feet or leg. A lot of diabetic patients have this because their sugar with the cholesterol, they plug up all the vessels and become really, the arteries or blood circulation become very poor. So you really have to look at that, and you really need to figure, wow, hey, if my sore doesn't heal, you better start talking to the doctor, find out is your sugar too high or your cholesterol very high. You got to start talking to the doctor to make sure this will not continue to blocking circulation to the toe and feet and leg. Because if that is actually happening, you might end up losing your feet, okay? Now, especially your feet, if you say your feet become pale, bluish, wow, boy, you can definitely more so quickly go to see a doctor, because that is something that meaning the circulation becomes so bad that it becomes turning blue now. That's mean if you continue that done, you actually have a dying foot, okay, or dying leg. So you got to make sure that you are really going to a doctor to check it out quickly, and maybe hopefully there's something they can do for you to help you prevent that you losing a leg. Now, also a lot of the people who, especially diabetic, they start losing the hair on the leg and the feet. And eventually the whole feet have no hair. I saw many of those. And that is another very quick sign to see, wow, this person has very poor circulation. And that might be a symptom for PAD, okay? So hair loss is a very obvious and also fast symptom to see. So these are a few things that you need to really look at all the time, especially hair loss that is an early sign, many of them. And it's also happened to many of the pre-diabetic and diabetic patients. So I saw a lot of those too. So really, this is a typical symptom, and this is something that you got to pay attention. Now, what is the risk factor? Why some people have more chances of PAD and versus the other? Now, if you're a smoker, you actually increase the risk of PAD because damage of vessel, reduce oxygen to the blood in the vessels. Now, if you're a diabetic, definitely you are high PAD risk, okay? Because diabetes, as I mentioned, the cholesterol and the blood mix together, the blood becomes thick and start damaging the vessels, start being plaques everywhere. All the exterior could be, vessel beyond your heart, everywhere, the whole body. Matter of fact, a lot of times it's the leg, and the arms could be kidney, everywhere. So diabetic is a high, when you're high blood sugar level and can damage your blood sugar, and you have a high chance of PAD. So you got to look at that. If you have diabetes, first thing you think, PAD, P-A-D, okay? Now, also you're obese, you're excess overweight, you also have high blood pressure, you're high cholesterol. You also have high risk of arteriosclerosis because all that is the typical symptom of the obesity. If you have high blood pressure, also is the same thing because you put extra strain on blood vessel, and then the plaque will form faster. You build up everywhere. As I mentioned earlier, vessels here, you form a lot of plaque. The vessels become less space. Blood pressure goes up. Big indication, PAD is there. And high cholesterol, so we'll talk about, will help you to lead all these forms of plaques everywhere. And you go into the vessel, adding the sugar, you start forming plaque, and you block the arteries, start going, blood going through. Hey, that is the problem. So really the risk factor, smoking, diabetes, obesity, high blood pressure, high cholesterol, this is definitely your high risk of plaque. So you might ask, hey, what is cholesterol? Now, cholesterol is a fatty substance that is normal for people, and they have to have it. It's a waxy substance. It's a body. It can use the energy. You have to have it. Now, there are two major cholesterol which you always need to understand. One is the LDL cholesterol. It's just the low density cholesterol, which is so-called the bad cholesterol. Now, if the LDL cholesterol continue to be very high, you will have a high chances to form a lot of plaques and build plaques in the artery and plaque up everything. So you have to continue to bring the LDL cholesterol lower. However, HDL cholesterol is a good cholesterol because it will take the cholesterol back to the liver and they will recycle, make it work again. And if you have high HDL, meaning greater than 1, then you are very good because this cholesterol is to help you to remove the LDL and lower the risk to have heart attack. So important, you have to lower the LDL cholesterol, build high HDL cholesterol. Now, we have figured, I'll show you how you can do that later. If the high LDL cholesterol, often because of bad cholesterol, it really increase arterial cholesterol. You always chances increase plaques everywhere on the arterial wall. Now, arteriosclerosis is actually a real issue. Imagine this is your vessel and your blood going through, but you have all these plaques formed over here. Even if it's stuck, blood cannot go through. Whoa, man, that's at the back of this side, the cells will die. So that's why LDL cholesterol, you have to continue to control. And doctor might give you medication. You might drink Lowsutea, which will help you lower LDL cholesterol. But important, you have to take the doctor advice to get your medication and the medication of to lower your LDL cholesterol. So net result, you will not continue to form so much plaques everywhere in the body. Now, arteriosclerosis is a plaque that can be formed with a fatty substance, high cholesterol, your cellular wall, all that come together. It form plaque, accumulate in the vessel. This is the vessel, for example. Imagine all this plaque coming through. Wow, that is no good because at the end of the day, all your artery becomes so narrow, blood pressure goes up. If it blockage, well, sorry, you have a dead cell on the end, then you have a problem very quickly occur. You want the blood vessel continue to be clear, easy to pass through. That is the key. On here already, you're going to have all kind of issue. Blood pressure go up. You can potentially block everything, and then you might end up with a stroke, heart attack. All this thing will come in. Now, formation of arteriosclerosis plaque that's several form. Now, certainly with that, you have no plaque is good. But on the other hand, there's also plaque that form and the go on. And some of them even leaks. Matter of fact, you can see that in your eye. A lot of the cholesterol come over leaks. So this plaque rupture in case of the blood clot can be formed in the artery, that is actually not good for you. So there's several forms of cholesterol that block. You can see how narrow that is going to be after a little while. So really, you want to make sure that you really got to cut down the cholesterol so it doesn't form all these plaques. And that's why I've been preaching for everywhere quite a few lecture which already talk about that. Because when you have plaques, you know what? You reduce blood flow from this end to the other end. Now, if you reduce blood flow, you know what can happen? Blood pressure goes up. Now, also with that, because you have less blood flow, so your activity, when you walk, you get cramp, you got pain, all that will come along. Now, on top of that, if you have complete blockage, then it's going to be an issue because your limb, you have a chronic limb, continue to have block, you can lead to pain, ulcer, sore, and it's not healing. But more important, if you suddenly totally blockage, you know what? That limb, that area, tissue is going to die. And then you might end up to have amputation. Now, a lot of diabetic patients get that because what happened in the leg, what happened is they have blockage totally in those areas like a toe or the leg. So end up the leg is start not getting nutrient, no blood. So the leg is not going to turn purple and darker and darker. Eventually, doctors say, hey, I have to save you by cutting a leg so you cannot just have a dead leg there. So that becomes gangrene and will be very stink and all that. But the thing is, you're going to start getting the whole leg start, you have to chop it up because of the fact it's no more used anymore. It's all dead limb. So you do not want to get yourself into that stage. I saw a lot of people have, you know, that limb really falling apart, and that is no good. And they can't walk anymore, okay? So really, now we're talking all about, well, you know, PAD, what it does, it really plug up all the arterial, and then eventually get worse and worse. And you really have to take care of it with, you know, doctor advice to really what need to do. However, in PAD, when you have high cholesterol, there's some lifestyle change things you can be prevented yourself to basically enhancing, including with the doctor work, that prevent you become less severe on your PAD or will even control your PAD, basically. Now, one thing very important, you have to drink Lowsutea daily. Why Lowsutea? Because Lowsutea is really just a herbal tea. It's not a drug. And it doesn't interfere of your drugs that you're eating every day by a doctor's prescription. And it's just a herbal tea that can help you to lower your blood sugar, cholesterol, and blood pressure level. And the cholesterol is mainly LDL cholesterol. And also help you to continue detox. And there are two items in there, only bitter melon, which is increased insulin sensitivity that makes you take more sugar to the cells. And excess, it will dump the sugar, cholesterol, and your salt out so your blood pressure comes down. And there's also the guava leaves, which is delayed absorption in the gut. And that's all it does. But it really helps, definitely lower your blood sugar and cholesterol. Let me give you one example. I just have a client, he came in with very high blood sugar, 16, meaning that that's minimal per liter. That means that this patient is like 250 plus milligram per dil. And so he is really a very, on the hand, in this, she doesn't have any symptom. It's really interesting. So net result of that, he has no symptom, but on the hand, the blood sugar are extremely high. Wow. And so I said, hey, look, you know, because your symptom with so high blood sugar, let's drink Lowsutea immediately. So he started drinking Lowsutea. Within 3 weeks, his blood sugar came down to 5.6. So now we're at 5 millimole per liter, or about 120, 115 area. So really that helps lower the blood sugar. Now, so net result, Lowsutea does actually help. Now, with that though, you need to change your lifestyle besides drinking Lowsutea. You have to eat balanced diet, meaning that you have to eat a lot of fruit, vegetable. Like for example, I always teach you guys, half a plate are all salad, meaning any greens, put in there. And then 1/4 is your protein, which is like fish, not red meat, fish, white meat chicken, cod, salmon, all the good stuff in there. There's a lot of selection, a lot of fish. Eat more fish, but not red meat, and eat more lean pork, lean chicken, and so forth. Then the quarter will be the whole grain, lean protein, tofu, red rice, and no saturated fat. Or you got to decrease as much as you can. If you keep up this diet, I can assure you, in about 3 to 4 weeks, your body totally will be very different. You will start losing some weight, your blood sugar going down, your cholesterol going down, your blood pressure going down. So really, diet nutrition does help you to basically lower the blood sugar, cholesterol, and blood pressure and prevent you from getting serious further to PAT, okay? Now, another thing, very important to prevention and enhance you from getting serious PAT or control. You really have to do physical activities. You cannot just sit down and watch TV whole day long, don't do anything. That would not help because that would just make it worse. So how do you do that? You have to walk. You have to walk 10,000 steps per day. It's very easy. Now, because when you have walked, you really can able to improve PAT. The exercise, the pressure of the walking is really help you to improve circulation of the calf. Now, however, a lot of times that when you walk, you might have cramp and pain. That's okay. The key is when you have that, you rest and massage a little bit and then continue to do that, but soft walking, but you aim every time 30 minutes and then even 45 minutes in an hour. So you do this regularly, PAT will really definitely will be helping by just the walking because you get the circulation. Now, you also need to have some strengthening exercise on the leg muscle. Now, one of the things that you can do is you can also do your Step Master. You can buy a Step Master step now. It's so cheap, $50 US, $30 US. You can get one Step Master. In Hong Kong, it's about $300 per one Step Master, Hong Kong dollars. So with that, you can do that. You have strengthened your leg, moving down. And then with that, in half an hour, you know what? You burn 300 calories. You get strengthened and exercise. Now, during the time, you watch TV, you watch whatever you want to like. You still can do that. And then you can, with a barbell, you can even do this exercise. And up and down in half an hour. Now, you also strengthen all your exercise here. Now, certainly with this, sometime when you do that exercise, you might have some pain, but that's okay. As time goes on, if you get tired, you basically help you out by sitting down and redo it again. Eventually, as time goes on, you're getting better and better. Now, a lot of people say, hey, I'm doing pretty good. One of the things that you can do is got a sandbag on your leg. You can do the same thing on a Weight Master. You can do that too. Now, some people say, I don't have Weight Master. No problem. Walk the steps. You can do the same thing. So the key is you got to keep that exercise moving, the blood vessels, circulation, putting pressure to it so you can able to expand the blood vessels and continue going to be good. As time goes on, you get stronger and stronger. Now, also, you have a bicycle, stationary bike, you can ride that. That's okay too. If you want to go swim, that is good. Or you can do yoga. The important thing is got a good walking, increased exercise activities. Now, you can talk to your doctor, which is best for you. That's okay, because they will give you the good advice. But nevertheless, it's very simple. It's just walk can be really help you already. So keep that in mind and start getting this activities going. Now, other lifestyle changes is very important because you got to start now. If you're smoking, you have to quit smoking. Now, smoking going to build up what? Plaques and also decrease oxygen to your blood. And then you can increase blood clot and also narrow arteries, so you might get stroke. Plus, you might get lung cancer. Wow, that would be worse. You don't want to get there. So, quit smoking. Immediately, you really improve your whole vascular cell health. You can breathe better. You can also reduce the continued PAD progression and improve overall cardiovascular health. Now, imagine if you start getting PAD, if you don't do anything, just get worse. Now, by the way, PAD cannot reverse 100%. In other words, you can just stop and control you on that part. Whatever plaque stuck, you already have it. So keep that in mind. It's going to start now. Don't think later. Don't think. So you got to be action to do it now. Now, certainly, the weight management is also very important. If you have excess weight, you have what? High blood pressure going up, you have high cholesterol going up, you're diabetic. So with that, you have a high risk of PAD. But if you lower your weight, you know what? You first of all improve your blood pressure, improve your blood sugar, your cholesterol level, and also your A1C. Remember, your A1C is with 5.7 to 6.4. Anything over 6.4, your A1C, if you're high up, if you lose 10% of weight, meaning that your weight is 220 pounds, you lost 10% now, 200 pounds. Your A1C 8 will drop down to 7, minus 1% of A1C. So definitely will help you to decrease your chances of getting worse diabetes, decrease or control your PAD, you decrease strain on cardiovascular system. And as long as you do that, your weight will continue to go down, will be extremely good for health. I experience myself, many of my patients experience myself, really, it drop your A1C down 1%, with 10% of your weight go down. So keep up your weight, okay? In addition, if you are an alcohol drinker, you got to drink less. You cannot continue I have my whiskey. Because your alcohol will continue to increase your blood pressure, you can get weight gain, cocktail, the blood sugar goes up, and increase the cholesterol level. So you really have to, don't drink. Matter of fact, best to just say, okay, I need to take off my drink, maybe half a glass, whole day of wine, maybe that can be done. But net result, if you stop drinking or having a very little moderate alcohol intake, you definitely increase your heart and vascular health. And then you can also manage better your cholesterol and blood pressure and also blood sugar. Because imagine the red wine or white wine has a lot of sugar in there. So you keep drinking that, you just add sugar. So that's something that if you can control, that will help. Now, a lot of people don't realize your stress management. If you're chronically stressed, continue, bang, 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 I work real hard. That actually increases the blood pressure, increases your heart rate, inflammation, the whole body. So all that contribute to arteriosclerosis, thickening, all the vessels, all the plaques start forming. So if you lower your stress, you lower your blood pressure, improve overall cardiovascular health. And on top of that, you decrease the risk of PAD and also high cholesterol. So isn't that great? So really, at the end of the day, important, lower your stress. Now, then you say, well, how do I maintain all these things going on? Now, very important, you have to always measure, what is PAD, high cholesterol, see where you are at. Now, really, at the end of the day, if you can early detect your PAD, and high cholesterol, you really has to come from routine screening. A lot of the patients that I see so far who actually understand, I have PAD. The reason is because they went to the healthcare check with the doctor and start seeing a lot of exposure, a lot of veins start popping up, and the high cholesterol come out, because cholesterol, you can only measure yourself through blood check, right? And A1C start going up. So the blood test is really where you can able to measure your cholesterol is high. Now, on top of that, you also start seeing your arm, your leg, your cholesterol high, maybe it starts swelling. On top of that, they also can measure your ultrasound, see you have any arterial blood clot in the ultrasound. Now, that's important because they also can look at your heart and look at your extremity also. And also, when you have physical examination, you really checking overall, do you have PAD and how's your overall vascular health? The doctor can do that, then you can early identify, then you can start early intervention. In other words, you need to treat. If you don't treat, the plaque will continue to get worse. And then you don't want to wait till the whole circulation become bad, you're going to start losing weight. That's too bad, because that is not something you want to do. Because with that, you can also understanding where you're at PAD, then you take action, because once you getting this leg become blue, it's really very difficult to reverse that. So really, at the end of the day, you got to work really hard to make sure your leg not become blue. Then you see a doctor. You want to make sure that you have some early sign of PAD, you need to start talking to the doctor and control it so it don't get worse. So net result, you will not lose your feet. And that's what we're trying to educate you guys. Okay, at the end of the day, you say, wow, doing all that is very nice because you drink Lowsutea will definitely lower your blood sugar, cholesterol, and blood pressure. Now, with that, you can able to, because your goal will be set to lower that, lower your blood sugar, cholesterol, blood pressure, then now you have much better health. You, even though you are not in pre-diabetic diabetes, you are, if you're 3 high being lower, meaning your blood sugar, cholesterol, and blood pressure, you're 3 high lower, you know what? You will never go on to pre-diabetic, and you will not have your chance to become diabetes is extremely lower. The key is continue to look at lower your 3 high, and so you don't get the cholesterol or blood sugar or blood pressure high. Then the risk of your PAD is much substantially decreased. Now imagine PAD is a serious condition because it narrows the peripheral arteries, so the blood cannot go through. It might affect the leg and arm or the extremity. And really, the common symptom you will feel is usually pain, cramp, numbness, and you start seeing veins showing out on your leg. So the risk factor come from that is really you smoke, your diabetes, your obesity, high blood pressure, high cholesterol, all that will give you the risk of getting PAD. But your high cholesterol, you really make sure that chances to give you plaque because they start forming your high cholesterol, the cholesterol and the blood sugar mixed together, become plaque everywhere, the whole body, outside the heart, or within the heart. All that will continue to develop to form this atherosclerosis plaque, which is now less blood going through, and then eventually if it totally blocked, you know what? You lose wherever the blood sugar, the blood, the circulate to the organ behind or the leg behind it. So very important. You have to think about high cholesterol will contribute serious PAD. High bad cholesterol, meaning high LDL cholesterol. Now you understand the link between cholesterol and PAD. The important is you gotta match your cholesterol and the blood sugar. So make sure you are not getting to be serious PAD all the time. You have to have a holistic approach, changing lifestyle with a diet. You have to talk to your doctor all the time, and then make sure that you have exercise, you are controlling your weight, and manage your with the doctor medication, lower your high LDL cholesterol. You want to lower that and continue with checking the doctor to make sure that your intervention, the things you do are correct to decrease PAD. So today's seminar, I hope we can give you an idea what PAD means. And a lot of people just didn't think about it. So net result, when PAD becomes serious, then they start thinking about it. Maybe at the time might be a little too late because your leg is already turning blue, very cold, and then you have difficult feeling with it. So you don't want to get your leg become dying and then you got to chop your leg. That's not good. So don't fall into that trap, and please continue to check to this prevention, and you can do it. You just need to check, make sure you talk to the doctor. Do I have PAD? Do I have PAD? How can I do it? So changing lifestyle is so important. Plus the medication decrease cholesterol and all that is also important. Okay, today has been webinar. You have any question, you can write to me, Andy, A-N-D-Y, at wafong.com. Andy, A-N-D-Y, at WAHFONG.com. Or WhatsApp us at 852-300-5644 or 852-6792-8891. So we hope that we can hear from you, because a lot of people do write to me, and I actually am very happy to write back and let them know what they think on the things that they ask. and hopefully we'll give you some form of solution to help you to maintain better health. And what are we here to do is to provide holding a hand throughout your diabetic journey, to also empower you to learn about all the things that we're talking about, and you can able to become better health and not to fall into PAD, not to fall into pre-diabetic diabetes, continue to lower your 3 high. That will be your objective. All right. Thank you again. Take care. I hope you have a wonderful weekend and be healthy. Thank you again.